Is coffee and tea intake associated with improved brain health? Can hypertension notification on smartwatches improve population health? Is aluminum contained in vaccines safe? This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, February 13th, 2026. I'm Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hi, Preeti. Let's get started.
Hi, Kirsten. First up, let's talk about a study on something familiar to many of us, caffeinated beverages. Dr. Zhang and colleagues looked at the association of coffee and tea intake with long-term cognitive function and dementia risk. The investigators conclude that greater consumption of caffeinated coffee and tea was associated with a lower risk of dementia and modestly better cognitive function, especially at moderate intake levels, which is about 2 to 3 cups of coffee or 1 to 2 cups of tea per day. The authors used a prospective cohort design, which included female participants from the Nurses' Health Study and male participants from the Health Professionals Follow-Up Study. Combined, this included more than 130,000 individuals who provided their intake of caffeinated coffee, decaffeinated coffee, and tea every 2 to 4 years using validated food frequency questionnaires. Follow-up continued up to 43 years to assess the primary outcome of dementia, which was identified by death records and physician diagnoses. The authors reported that more than 11,000 documented cases of dementia occurred among the prospective cohort.
These studies are hard to do, and I'm sure there's much to discuss, but for now, I'll keep drinking my coffee. Emergency department-initiated buprenorphine has increased treatment engagement for opioid use disorder in multiple cases. In a new randomized clinical trial, Dr. D'Onofrio and colleagues compared extended-release injectable buprenorphine with sublingual buprenorphine. The investigators included nearly 2,000 adult patients from 29 U.S. sites who presented to the emergency department with untreated opioid use disorder and a clinical opiate withdrawal scale score of 4 or higher. Participants were randomly assigned to receive either a 24 milligram injection of extended-release buprenorphine or sublingual buprenorphine with a 7-day prescription. Both groups were provided with a referral for ongoing medication with a scheduled appointment within 1 week. There was no difference detected in the primary outcome, engagement in opioid use disorder treatment on day 7, which occurred among 40.5% in the extended release group and 38.5% in the sublingual buprenorphine group. The authors conclude that both formulations of buprenorphine were well tolerated and precipitated withdrawal was rare despite a high prevalence of fentanyl use.
Dr. Mo and colleagues authored an editorial to accompany this trial. They highlight the importance of emergency departments as opportunities to identify individuals with high-risk opioid use and to engage them in care. They also stress the importance of rigorous studies to confirm best practices and increase access to life-saving opioid agonist therapies. Kirsten, there were several very interesting JAMA research letters this week.
Oh, yes. Dr. Cohen and colleagues report results from a cross-sectional study evaluating the Apple Watch hypertension notification feature, which can notify wearers of possible hypertension without using a blood pressure cuff. The authors assessed this notification feature among U.S. adults aged 22 and above without diagnosed hypertension using data from the National Health and Nutrition Examination Survey, or NHANES, from 2017 to 2020. The population was representative of 127 million U.S. adults. The authors report that the positive predictive value of an alert was 69.1%, and the negative predictive value was 79%. With more than 200 million Apple Watch users worldwide, the hypertension notification feature offers opportunities to identify adults with undiagnosed hypertension, but the potential for misclassification was noted as well.
In their research letter, Dr. Diego and colleagues report findings from a retrospective cohort study of in vitro fertilization, or IVF, outcomes in female same-sex couples using data from the Society of Assisted Reproduction and Technology Clinical Outcome Reporting System. In reciprocal IVF, both partners participate. One donates the egg and one carries the pregnancy. This contrasts with autologous IVF cycles in which the person undergoing oocyte retrieval also carries the pregnancy. The investigators found no differences in probability of clinical pregnancy and live birth between reciprocal versus autologous IVF cycles, although the rate of singleton preterm birth was slightly elevated for reciprocal IVF cycles, 15% compared with 11%.
The new JAMA viewpoints are thought-provoking and timely. In one viewpoint, Dr. Belinsky explains why it is unethical not to conduct randomized trials in pregnancy. In another viewpoint, Dr. Shakar and colleagues write about what the new AI executive order may mean for medical AI regulation and highlight the many legal questions it raises.
Thanks, Kirsten. I enjoyed reading both of those viewpoints. Food and beverage safety are important topics, especially with California's 2023 ban on 4 food additives, followed in 2025 by 30 states proposing or passing ingredient warnings or bans. In their viewpoint, Professor Pomerantz and colleagues review pertinent federal food safety legislation and what these new changes could mean for the food industry. In another viewpoint, Dr. Markovitz and colleagues explain how to maintain the quality measurement in a system designed for traditional Medicare as Medicare Advantage coverage becomes dominant. And Professor Moser and Dr. Offit contributed a perspective article about a common element in nature, aluminum. Aluminum has come under recent scrutiny for its presence as an adjuvant in some vaccines. In this perspective, the authors provide helpful information on aluminum's presence in immunizations. They also include a summary of the evidence on other environmental exposures to aluminum and when aluminum can be toxic in the setting of chronic kidney disease.
JAMA listeners are familiar with the problems of opioid addiction, with nearly 4% of U.S. adults affected by opioid use disorder in 2022. The JAMA Clinical Review by Dr. Harris and colleagues reviews medications for opioid use disorder, as well as the management of opioid withdrawal and opioid overdose. The authors also discuss the efficacy, safety, and practical considerations of treating patients with medications like methadone, buprenorphine, and naltrexone for opioid use disorder. Author Dr. Alex Wally joins JAMA Deputy Editor Dr. Kirsten Walter to discuss this topic on the JAMA Clinical Reviews podcast. And clinicians can share the new JAMA patient page on medications for treatment of opioid use disorder. The information could be life-saving.
There's a Women's Health JAMA Insights about cesarean delivery on maternal request. Doctors Alpern and Artson compare maternal and fetal outcomes for different modes of delivery and share important information for counseling patients who request a cesarean delivery.
And look for 2 additional JAMA podcasts this week. Don't miss my conversation with entrepreneur Mark Cuban, who co-founded Mark Cuban Cost Plus Drugs. We discuss what can be done about the high cost of medications in the U.S. and specifically what clinicians can do. The interview can be found on the JAMA Clinical Review podcast. JAMA Plus AI Editor-in-Chief Dr. Roy Perlis talks with Associate Editor Dr. Yulin Schwen on the JAMA Plus AI Conversations podcast. They recount recent articles highlighted in JAMA Plus AI that cover everything from patients' messaging to integrating more critical thinking in medicine.
The JAMA Medical News team has a summary podcast that publishes every Friday with all the latest in medical news. You can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti, and thank you to our listeners for tuning in to hear what's new at JAMA. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.